Good afternoon. This is Kim McCoy-Wade from the Department of Aging, checking to see if everyone can hear me. We're trying something new today, not only convening by Zoom, but also convening from locations scattered all over the state. We're going to give it an extra minute. It looks like people can hear me. We're going to give it an extra minute because given the interest, we changed Zoom rooms. So thank you for virtually changing rooms with us this afternoon. We're just going to give it an extra minute. The numbers are starting to climb. So I see people are either getting the new email or new calendar invite or went to the old location and got the redirection. So give it another couple minutes. All right, let's check in. We've got about almost more than half of our equity work group has joined the call. Let's give people just a couple more minutes. And we have 40 members of the public calling in as well. Welcome, thank you. Again, we're taking just an extra minute to get settled in our new room. So thank you for coming over with us, and apologies for the change in logistics as we all get used to our new reality here. Especially want to wait for our co-conveners, Rigo Saborio from St. Barnabas and Kevin Prindeville for Justice and Aging. Until I see them pop, I'd like to give them another minute and then we'll get going. Oh, Rigo, you heard me calling. Welcome, Rigo.
Can you hear me? Thank you.
Yes, and then I see Kevin. Kevin, are you here as well?
Yes, I'm here.
Great. Okay, great. Thank you. Thank you for joining us here for this equity work group strategy meeting. We did just change the room to allow for the high interest in this conversation. So thank you for those of you who joined us and then changed rooms. We've got, looks like about a dozen of our equity work group membership here, and then another 40 attendees listening in, as those of you who are using those Zoom features can see. Let's go over, as we always do at the start of our meetings. If we can do the next slide, just a reminder of how this works and how we're going to be together and what we're going to do. So again, those were the Zoom guidelines, and here's our kind of meeting protocols that we have used from AARP to start and end on time. We're trying our best. One person speak at a time, and be present, be respectful, and assume the good intentions that we're all trying to bring to the table. Here's what we wanted to do today. We wanted to very quickly, most of all, we wanted to be together and think together and support each other together. I would like to very, very quickly share some information about what's been happening at the Department of Aging and more broadly the administration as we all move to respond to COVID-19, but really we want to turn it over to Rigo and Kevin and Carmelita to facilitate an equity discussion, as we've called this a strategy session, on how all of California's diverse communities are responding, the strengths that are emerging, the challenges, and perhaps some recommendations, some real-time recommendations for how we can strengthen our response together. We'll have public comment and conclude with next steps. I'm going to skip introductions in the interest of time and just know that, trust that you all can see the participant list and the panelist list, excuse me. The panelist list has everyone's name listed. So hopefully we can just jump right in. Just a couple of things I want to share about the response to COVID-19. I mean, first of all, obviously, I don't have to tell anyone here how unprecedented this is, how challenging this is, and how fluid it is. There's so much of an impact on all of us, on our own lives, on our families, people we care about, on our work, on our mission. Whether you're helping move your office home or caring for a relative, an elder, a child, yourself, experiencing your own, as an at-risk person, your own journey, or in fact, you've been sick, we're all dealing with this, and it is an unprecedented challenge. Particularly for those of us who are working on the master plan, it has really brought to the fore some of the challenges and opportunities that we had identified together in the aging space and had begun to identify and begun to surface, moving towards a master plan. And we, as you know, we have put that master plan process on pause and will be picking that back up, of course, changed and influenced by what we learn and what we do in this response moment. But it is true that we have used that in many ways has been kind of our training camp in terms of identifying issues, building relationships, and for purposes of today, beginning to use an equity lens. And so I'm so grateful for this group that we had assembled this table, that we had met at least once, and that we could call on you with short notice to reconvene, to begin a conversation about an equitable response to COVID-19. Let me just share a little bit of information about where the response with aging and at-risk adults has been. I'll be very quick, and then talk a little bit about equity focused actions that we've started to take, but that need more thought and more additions as well. Starting with the aging response, there's a number of fronts we've been working on, playing to department strengths here at Aging. We've been very focused on information, making sure that information is getting out. That you saw the governor launch the check-in campaign, really promoting that check-in, and then hopefully making it easier for people when you do need information to call that new state COVID hotline number that we can share again, as well as really support the 211s and being a no-rung door. And we can talk more about the issues 211 and the COVID line, ways in which they do reach all Californians, in which there are gaps. But that trying to be clearer about the need to check in with people and make sure that we all have our food, our medicines, human connections, and places to go if we aren't safe or well, make that information clearer and make it easier to know where to call for help. We've also been incredibly focused on nutrition. Obviously, our home delivered meals program, the need is skyrocket. Our congregate meals have had to flip and become delivery services. And of course, food banks and CalFresh programs that older adults also use are experiencing unprecedented requests for service and a need to provide delivery in new ways. A third area of focus is isolation, looking very closely and pushing this message of connection, 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 but also looking at how we reinvent traditional engagement activities. Again, community centers that serve seniors turning into telephone and home delivery, and looking how we can up our behavioral health support in this time. A fourth area, home and community health, more important than ever, that we are helping families and older Californians stay home and stay healthy. Part of that is keeping our hospital beds free. Part of that's keeping people away from sources of infection. So really, we're working hard here at CDA with our adult day health centers. How can they become centers beyond the walls? Telephone service, in-person service in the home, and where needed, on-site individual services, practicing all the public health precautions. The fifth area, residential rights. Obviously, what's happening in nursing homes and assisted living and all facilities of great concern to all of us. And here at CDA, we run the Ombuds program, the long-term care ombuds person, and how do we ensure that ombuds who can no longer get into those buildings, again, how do the services go beyond the walls? How do we have telephonic and other access and other ways of keeping families and residents supported? And then, largely thanks to the MPA, the sixth thing that we've been doing is really that role of other department advisor and convener. Just this morning, we were talking to the Department of Technology about the digital divide and how we make sure we bridge that for elders as well as for school children. We continue to be advocating for geriatric expertise on healthcare decisions. So we really do try to be that voice and to get that seat at the table on behalf of older Californians and all who care for them. So with the equity lens, how does that apply to those kinds of areas for work? I mean, again, Some of the things we talked about in our previous meetings, trying to make sure that as many of those phone lines have as many language services as possible, whether it's the state's new COVID-19 line, the 211 line, our area agencies on aging, their adult info lines, adult protective service lines, all of those need to have language access to be meaningful. Similarly, the materials, we at CDA have a commitment to English, Spanish, and Chinese in our materials. Of course, that's only scratching the surface in many communities and want to dig deeper. We also have been looking to see if we can dig deeper in some ways. While AARP is doing a mailing of these key numbers and key information to all their partners, and they reach many, many people, and we're very grateful for that. We also want to make sure we reach beyond, and so we're looking at possible partnerships with ethnic media or ethnic radio to try to reach some other audiences to make sure we're targeting our outreach on that check-in campaign. We also want to provide more support for family caregivers in a moment. I'm so pleased that Master Plan on Aging stakeholders and equity work group stakeholders have come forward with a new idea for some family caregiver support, kind of a repurposing a webinar Wednesday that they can talk about briefly. And we also, as I mentioned, are trying to close the digital divide, very interested in broadband and device and skills issues, onboarding issues, broadband, particularly in the rural community. We know that digital solutions aren't for everybody, but they also can be huge for social connection, telehealth, even online grocery and delivery. Another area we're looking at is trying to make sure that as we go forward, data on COVID impacts, both direct COVID-19 impacts and non-COVID-19. So for example, death trends, that we get those by race to make sure that we are seeing disparities that were there before that may play out here, as well as other impacts, right? Wanting to make sure we are one California, but we're going to experience this differently. And then part of why we wanted to convene you all is we know more than ever that partnership with community-based organizations that have the trust, that have the relationship, that have the expertise, that have the history, that have the connections are going to be critical. And so want to also think together with you about what that could look like as we deepen our partnership at this moment of urgent need. So let me just stop. That was the quickest, highest level on kind of the major areas we're working and how we're trying to make sure we're truly reaching all Californians and responding and being relevant to all Californians, but know we can always do better and more. So with that, I'll stop and turn it over to the next piece of our agenda. I believe Rigo and Kevin, you're going to start us, and Carmen are going to start us an equity discussion on COVID-19.
Yes, hey, this is Kevin. I thought that Carmen was going to get us started here, but I'll take a minute while she's getting set up.
Hello.
But this is Kevin with Justice and Aging. Just wanted to thank you all for being with us today and thank Kim and your team, Kim, and the governor for all the work that you're doing. And we know there's even more that we could be doing for older adults in this time. And we appreciate the attention right now in this space to these critical equity issues. So I think Carmen was going to start us with a discussion of strengths and challenges.
Yes.
Yeah, great. Thank you.
Yep, you're unmuted. Go, Carmen.
Oh, wonderful. Thank you. No, just echoing Kevin's sentiments. This is a challenging time, but with challenge comes opportunity. So echoing just Kim and what Kevin said, thank you so much for being here. And we have a lot of different things that we're doing right now, but we really want to ask you all first, what are the strengths and challenges that you're seeing in your communities? What can you describe what you're seeing on the ground with the organizations and your networks? So I think the best way to probably do this is there is a raising the hand feature, and maybe that's how we can go forward with what we all just want to hear from you, because you all are the experts right now. Are you seeing language access issues? Where are you seeing those disparities? Are you seeing people struggling, some people struggling more than others? And what's that looking like in the areas and the communities that you're in? So but we also want to hear what's working. Maybe there are some things that we could duplicate at a state level. those strengths, we want to touch on those, and maybe we can take this back and make adjustments to what we're doing on our end. So I want to open it up to on the floor to see if anyone has anything that they would like to offer.
I would go, I'll go ahead and kick it off. This is Rigo, and obviously I working with St. Barnabas and sister agencies who are primarily serving a very low income, mostly low English proficiency capabilities. What we're seeing in terms of our challenges is exactly right on point of some of the things that Kim's identified, that which I'm really pleased to hear, because for example, the digital divide is hitting hard. I had earlier conversations today with a couple other groups about this, and particularly we're seeing among low income older adults, although many of them do have smartphones, they do not know how to leverage that, how to maximize the utilization of those smartphones. So we're grappling with that issue, and that's now hitting us hard. And as I use the example, is for example, another issue that we're also seeing, even though I think entities, including the state of California, is translating material, there's still other information and other real-time documents that are coming to our clients' homes. And because our case managers aren't able to be there in person as we would usually be, they're bringing, for example, documents that are in English only, and they're needing translation. And if they had the ability to utilize their smartphones and, quite simply just take a picture, attach and send back, we could perhaps use that as a methodology to be able to help in translation. But so here we have a sort of a cross of these two different issues that we're having to deal with in that situation. So I'm really pleased to hear that from Kim and the team that is really looking at this, because the digital divide is very real. And I would also add that given the communities that we serve, there is also a broadband issue within the urban settings as well. It's, I think we need to bring more attention, and obviously it might not be something that we can address today, but certainly something that we can start really advocating on behalf of is more investment, not just in rural areas, but also in low income urban areas, for better quality, faster speed internet, because in some cases, even if you want to connect, it's very difficult. And as I think some of us are experiencing just in our own daily connections, everybody coming online is even making things even slower. So these are just some of the things that we're experiencing, and some of the challenges that we're facing above and beyond sort of the other kinds of things with meals and isolation, things like that.
Thank you. Thank you so much, Rigo, for opening it up. And I see 2 people in our queue, so that's a great start. And you're mentioning a lot of things that we really want to improve on. First, Karen, and then Eddie.
Hi, yes, this is Karen Lincoln. So we are actually collecting data for many of our African-American constituents, primarily in South Los Angeles. We've also connected with some agencies in the area asking about what some of the needs are. The primary needs have come back as hygiene kits for many of the people that we serve in the area. We also have, obviously, we have broadband issues. I mean, this is one of my concerns and has been for many, many years in terms of African Americans having one of the lowest levels of access to broadband, particularly older African Americans. About 38% actually have access to the internet. And so we're also asking our constituents about whether they can get their medications and get food and necessities online or not. The other thing that's coming up in the data that we're actually collecting are the fact that many African Americans, because they don't have access to some of this information online, are getting information late, if at all. Notices that are coming, even though it's in English, are not very easy to read and understand because of literacy levels. And also food, toiletries, etc., that are already difficult to get because there are fewer markets in many of our neighborhoods, are even more difficult to get. And so many of our constituents are unable to disinfect their homes or have exhausted their supplies of paper products to disinfect their homes or don't have access to these things. And so I think the gap is widening, obviously, for people who are already at disadvantaged levels with respect to getting their hands on these kinds of products and being able to afford them. But with the sheer sort of absence of these products and the low access in terms of where to buy these products, it's becoming even more problematic.
Yeah, we're definitely seeing that around all these regions. So, but it's definitely exacerbated in the low income areas. Thank you for that. Eddie?
Hi, yeah, this is Edie Yao from
Edie,
Alzheimer's
I apologize.
Association. That's
Edie.
okay. No problem. So at the Alzheimer's Association, we're definitely pivoting and offering more of our educational programs virtually where we can through webinar. And we've had one major success, which is for our Chinese-speaking population. We had a Chinese webinar on Alzheimer's disease with researchers and physicians speaking. And we had 540 unique users on during the 3-hour session on a Saturday, last Saturday. It was conducted in Mandarin, and people came from across the country and even internationally. We had a few callers from Australia and Czech and other places. So I think that the webinar format does work for some. And this was our Mandarin speaking population. And so these folks do tend to come from Taiwan and other places, but more accustomed to technology. I don't think that this will be quite as successful with our Cantonese speaking population, given in Chinatown or Oakland area, where may not be as tech savvy. And then I think to Rigo's point about the smartphone, I've heard this recently. We did a task force meeting in Central Valley, Fresno area, and I've heard this repeatedly that many households do not have internet, and even if we were to offer it, I'm not sure that they are quite equipped to use it. People do have smartphones, but they don't use it for work like you and I do. They use it for their day-to-day basic functions. So I think that really what we have to consider is, in addition to offering webinars and to provide information and education, we really need to look at just phone options, low tech as possible. AARP's town halls, teletown halls, I think are a great example of that. And then most recently, I've also heard from an organization, I think it's Covia, where they do phone support groups or phone education, that even for our older adult population, to have a 10-digit PIN is also a barrier. So I don't know what system uses, dial the phone number and then you have some kind of an access code, but whatever they're using, it's only 1-digit access code that they use. And that allows people to be able to get on easier. 10 digits is apparently too many. The other thing I would share is that, thinking about our isolated populations, that some of our more marginalized communities are even more isolated during this pandemic. And so our LGBTQ folks in particular, and a nice example of a good partnership is Open House in San Francisco has partnered with Mon Ami, which is a volunteer visitor type of program. And so they're setting it up so that they can call many of their isolated seniors. So, I think there's some great partnerships happening in the midst of all this. but definitely looking at different types of formats of offering information and education. And also just, I think this was mentioned, but echoing the idea that when we are providing that information in multiple languages, the translation isn't really enough. It's really looking at education, literacy level, and I've heard this from the Mexican consulate recently, to simplify it and making it relatable. So, you know, we just put out a topic sheet on COVID-19 and caregiving, but I can already tell our Spanish version, it's got way too much text, and the format is just probably not relatable to our Central Valley folks. So those were my main points I wanted to hit on.
No, those are definitely some great points, talking about, you know, again, digital divide. How do we make it accessible, as well as, you know, holistic translation? I think that's what you're making me think of, those words. And, you know, we have to continue with language access. We have 3 more people in the queue, and because I want to get to Kevin's part. Thank you so much, Edie. Cheryl, Marty, and Marcy. You're gonna be our last 3. So Cheryl Brown, why don't we start with you?
All right, thank you. I'll be as brief as possible. I've been talking to the people in the community. I have not been out of the house, but I've been talking on the phone. And I was having a meeting with some of the business people and ministers on yesterday or day before, and I was telling them about the money that these seniors are going to be getting in a couple of months or a couple of weeks, but they're going to be getting it. So the scams are going to be really, really out there and very, very difficult for our seniors to navigate. And so I said, well, you know, if we could do something and teach them how to use their smartphones. One of the pastors just started laughing, and he said, our members have jitterbugs. He said they don't have a smartphone. So he was telling me that we need to maybe work on even trying to get some smartphones, trying to get some connectivity down here. And I saw what the governor did with the students, and I'm wondering if we can't look at doing that with our seniors, where you provide the device and you provide the connectivity. That's number one. That digital divide that Rico was talking about is where that all comes in. We also had a case where we're having some problems with husbands and wives being in the house for so long. We have a senior who, his wife just got so fed up, she left the house, went over to her daughter's house. No one checked on him for several days, and he had not taken his medicine, and he had not eaten anything. So the church sent some nurses to his house so that they could take care of his needs. So that's another issue. The loneliness is something that we're dealing with in our church, and our pastor's dealing with that. One of the things that people are asking for is masks. Well, if you're not going out of the house, you really don't need a mask. And so we're trying to keep people at home, and that's what we're telling them. You're supposed to stay home. People who are caregivers, that are caregivers of loved ones with Alzheimer's, are really being hit hard. And yesterday, one person called and said, you know, I just have to get out of the house. I have to get out of this house. And just left his wife, who had just fallen twice, and he just had to leave the house. Now, on what's working, I think on that side, that's what struggles are. But what's working is it has made, especially the churches in our community, it's made them all get on Facebook Live so that they could have their services. And a lot of people are starting to get on there if they have the connectivity, which is really good. And then someone said something about people, the 10-digit PIN numbers and so forth. Well, Congressman Pete Aguilar, he has conference calls, like he has town halls and they are telephonic, but when he calls you, you just press 1 and get into the call. So I thought maybe that might help. And I don't know how they do that. He just, it's done. So that's it.
That's wonderful. No, exactly. That 1 digit rather than putting those 10 digits in, that seems like that's a good way. And churches becoming more active on Facebook. So we all alone together in that way. Okay. Marty Lynch. And then we're gonna, so I see a couple, let me just say this before you start. See a couple more people raising their hand, just in the interest of time. I'm gonna have Marty Lynch and Marcy Adelman. I'm apologizing if I'm mispronouncing your name. We're gonna do that. And then I'm gonna take the comments of, if we can put them in a chat box. We have Dr.
Well, you know what, Carmen, this meeting, we don't have a chat box. So I'm going to ask Marty and Marcy if you could do, a minute or so, and we can, Carmen, do short handoffs between speakers. We might be able to hear just a little from more people if we could all do that. And we can always talk more and talk soon, but I do want to hear from a few more voices if possible. So Marcy, Marty, Dr. Clark Harvey, Derek Lamb all want to get a word in. So maybe each of you could do a minute or so and we can keep moving.
Yeah, this is Marty Lynch. I can be quick. So I ask our geriatricians at our over 60 health center site, and that serves low income, mostly African American elders, what they were seeing. And the main thing that they raised was, as the health system pivots to virtual, their older and the older age groups and low income patients are not having the ability, because of the technology, because of hardware, broadband issues, and sophistication with the technology, with the smartphone, whatever it is, to do the virtual visits. And they feel that that's putting the patients at risk because they may have to come in for a visit. And of course, it puts the provider at risk too. So that whole area is an important one. Secondly, I would just say that Kim probably knows, but others may not, that the health plans have been asked to come up with a strategy to reach out to their older and disabled members. Now, in most of the health plans, certainly the older duals members are mostly diverse population folks, and we're missing an opportunity if we don't work with them to help them figure out the best way to do that. So I hope we can work with the plans, Department of Managed Health Care, and DHCS on that messaging. So that's it. Thank you.
Hi,
Marcy.
Hi there. This is Marcy Edelman. Just very quickly, DAS did an equity analysis in 2018, and they found that LGBT seniors were the most underserved, one of the most underserved communities, but that are more likely to utilize LGBT senior service providing services and agencies. So we really have to get the word out through LGBT media, newspapers, to folks, and to really shore up the community nonprofits that are really doing just an amazing job, but are quite overwhelmed having to use the phone to reach out to people. For the most part, old folks just don't have the technology to do the visits online. So for example, an open house called by phone every person who had come through their door since 2019, at the beginning of 2019. So that puts these community nonprofits, they're really stretched. And so one of the things that's happening, which is really inspiring, is to see them, the community nonprofits, coming together to coordinate their services, and doing that with the Department of Disability and Aging here in San Francisco. And that coordination is happening both at the Mayor's Office of Transgender Initiative and the reconvening of the excuse me, LGBT Aging Policy Task Force. So many of the folks are not using and haven't used historically mainstream services. so it really puts the pressure on these few agencies to really carry the burden of the work. And they need relief in a number of areas, like in technology, especially, not just for to assist their clients, but their staff as well. So that seemed like the most important point. The others are also true in terms of food, nutrition, and having enough hygiene and disinfectants on hand. These are the same issues everywhere, I think, across the board. Thank you.
Dr. Clark-Harvey.
Hi, just real quickly, want to share that the members I represent are behavioral health clinics, and we've moved all to virtual care mostly. And so I know our members were concerned about the Wi-Fi issue, and so I created just a compilation of different documents, even things that other states are doing to assist in this area, including like kind of a map of where there are hotspots that people can go to if they need to engage in telehealth or other communications via telehealth. So I'm happy to share that. I was looking frantically for the chat, so thank you for assuring me that I wasn't losing my mind. There is no chat. But I'm happy to share that with you, Kim, after, if that would be helpful and useful to the group.
Absolutely. Derek Lamb, last comment, and then we'll pivot to Kevin.
Oh, thank you so much. I think some of you may be aware the rhetorics from some of our national leaders and legislators blaming, China as the origin of the COVID-19, and while this might be true, I think everyone needs to be aware that it has generated much hatred towards Chinese, and since we are, in a group looking at equity, and my hope is that at least California, as a state, can do something about it.
Thank you, Derek.
Thank you all. Okay, so, well, I think this is just a testament. Thank you for all talking about your strengths and challenges that you're seeing. And I'll turn it over to Kevin, and he can do the next part of the discussion.
Yes, thank you so much, everyone. We were gonna, I think, just talk more. This might be just a vehicle for us to share more ideas, but talking about how it's critically important. One second, I'm sorry.
I couldn't tell if that was my children or Kevin's children, so I'm glad it's Kevin's children. But we are all managing in new and different ways, and it's okay. It's okay.
I'm
it's
back.
all about family. Yes, go for it.
I'm back. Yeah. So those were my kids. Sorry about that.
No, don't apologize.
But yeah, so really talking about how we are sure that our response in this moment really puts equity at the center. And we thought we could use a blog post that one of my wonderful colleagues, Denny Chan, wrote this week that really highlights the intersectional nature that many of the older adults in our community are experiencing this crisis in. The blog centers on stories about older adults who are part of the Asian American Pacific Islander community in our country, and how the layers of their identity really inform how they're experiencing the crisis. And it kind of tells a story of an older adult who has been concerned about the virus for health reasons. Also hears stories about a neighbor who's experienced violence because he was wearing a mask on a bus and was attacked by people with racial slurs and with threats of violence because of the association that's been made between the virus and our AAPI communities unfairly and inappropriately. And that led the older adult to isolate even sooner than others had isolated, and layered on many of the other issues that we've talked about today, leaves some of these communities just more isolated without access to the services they need to be responding in this moment. So understanding that intersectional nature, what are some of the particular things that we need to pay attention to? And we've already started to highlight some of them in our conversation. Some things that were highlighted in the piece that Denny wrote included, the importance of our community denouncing racism, really understanding, especially for our AAPI community, that the racist and xenophobic attacks that community has experienced really impede their lives, impede their ability to get care at this moment, and for their health to be considered. And even the context of that racism and xenophobia is in the context of decades of racism and xenophobia and violence that community has experienced. So we need to have that be part of our response at every level, that we're denouncing the racism and the related attacks that are arising in this crisis. We need to acknowledge the heightened needs that communities are feeling because of the intersectional nature of their identities. So for example, in the story in the blog of the older woman who isolated sooner because of her concerns about racist attacks. So, some of our communities have been isolated even longer than the social distancing or physical distancing orders have been in place. And so their need for food and socialization and community-based services is even heightened. The importance of cultural competence, understanding how recommendations around masks impact different communities differently. Thinking about how food and the relationship between food delivery and culture is so critical. That leads, of course, when you think about cultural competence, also language, and we've talked about this some already today, the importance of the language being right for all of our communities. A couple things that we didn't hit on in that blog piece that I wanted to add here after talking more with Denny and looking at some of the responses we've received from that piece is the intersectionality here of income, of how low-income older adults, that identity of low income also often intersects with the other identities that our group focuses on, and how that can lead to disparate access to resources in this moment, whether it's the digital divide and tech issues we were talking about already, or healthcare issues. Another thing that intersects here is health disparities and the prevalence of certain conditions in specific communities of color, and how that might make them more vulnerable to the illness and to some of the great ramifications from the illness. I think a really shocking and sad example of this is that where the data is tracking impact of the virus in communities by race and ethnicity, we're seeing, for example, in Michigan, that at least 40% of those that have died are Black or from the African American community. And that far exceeds the percentage of African Americans in Michigan. And so we really need to pay attention to the way that health disparities are making this crisis particularly acute in some of these communities. And that idea ties in with something Karen brought up already, which is data collection. I'm so interested to hear more, Karen, about what you're doing there, because I think we do need to be collecting data, and we need to be looking at race and ethnicity in that data to understand how the virus is playing out. And then a final thing here, our equity group usually doesn't specifically focus on ageism because so much of all of the master plan for aging does. But I think here where we're thinking about equity, we need to look at ageism too, and how ageism can be impacting decisions about who gets care and what kind of care people get. AARP just put out a great statement today. Justice and Aging has a letter in the works and a statement in the works, and we're partnering with the disability community to make clear that issues of disability and age should not be factors in determining access to care, and we should not be using other terms which imply that age or disability is going to be a reason for which someone doesn't receive care that they need. So I think that's critical here too. So those are some of the a bit of a framework or some of the elements that we need to be looking at. Again, some that have already been mentioned today. And I think here we'd love to just continue to get feedback of the elements that need to be front and center in the COVID response, both for the state, at the local level, and in our organizations as we're all doing what we do to be responsive at this time. So it looks like there's already hands raised and ready to participate. So I'm gonna go to just take them in order here from as I see them. So it looks like Karen has her hand raised.
Oops, sorry, Kevin, I forgot to unraise my hand.
I think the new hands are Marielle or Jeffrey.
Okay, well, let's go to Marielle then.
Hi, my name is Marielle Creasel. I'm with Disability Community Resource Center, and I was on a call earlier today regarding healthcare rationing, and I think it's a significant issue that is impacting people with all kinds of disabilities right now, as well as seniors. And we as advocates really, I think, need to be involved in discussions with hospitals beyond that of being, a patient, but just in the ethics conversations to put those, to put our voices as people with disabilities into the discussion. This was an issue that that existed long before COVID-19 emerged. And I think that the presence of this right now is just basically raising the issue and bringing it front and center. So the conversation really just encouraged me to consider how I might participate in those conversations with hospitals around the ethics of rationing care. Thank you.
Yeah, that's a wonderful point, and I think a wonderful place for collaboration with the disability community, which has provided great leadership on this, for the aging community as well. And again, a place where these identities intersect, whether you have a disability and you're an older person, and if English is not your primary language, how can we make sure that a hospital is going to provide the same care and attention to that individual and not have discrimination in the way that they provide care based on all of those intersecting identities. So critical issue. Jeffrey?
Hi, this is Jeff Reynoso with the Latino Coalition for Healthy California. Thank you, first of all, for sharing that perspective. I was reminded on a call earlier this morning that we have to get a little bit more nuance with our descriptions of historically marginalized communities. One point that I'll highlight that's specific to the Latino community, while it's true that the digital divide is very real, and particularly in specific regions in our state, the Central Valley and the Inland Empire in particular, our communities are on smartphones and they're accessing Wi-Fi and information on smartphones. In particular with Latino seniors, we're seeing a high usage and percentage of WhatsApp, which is a mobile app that is incredibly popular in Latin America. And in the United States, there was a Pew study that showed Latino usage within the United States, within the US is the highest among Latinos. And so one of the concerns for us with smartphone usage and information around COVID and WhatsApp is we're hearing a lot of misinformation being kind of shared widely from other countries in Latin America and disseminated among our communities. So that's one concern. And a second concern that we're hearing from our local partners is our communities are in multi-generational households. So, kids are home from school, and we're starting to get reports. One of our community partners that have programming in the Central Valley and the Inland Empire have highlighted the heightened anxiety among kids and the need for mental health services for kids in these intergenerational households. That we haven't been in a situation like this. So just wanted to highlight these points.
Excellent. I would like us to open up, as the technology allows, our team to allow some of our participants, in addition to, we just heard from many of our panelists, but we have 73 people also calling in for our Zoom version of public comment. Team, are we able to see raised hands or call on folks?
Hi, Kim, this is Nelson. Yeah, we can see raised hands right now. No hands are raised. So participants, please push *6 on your phone or click the raised hand icon and you can get into the queue for public comment. The first one is Bill Sieve. Go ahead, Bill.
Hello, everybody. Just wanted to let you know there's a Latino organization in Los Angeles called the Walls Memorials Project. And they're doing weekly Zoom conferences on spiritual health, mental health, well-being, and other activities to engage the public. So there are activities out there, but we just need to identify them and network with them, you guys. Also, I was on a press conference yesterday with the trans community, and they were addressing this head on. What I'm going to do is email their talking points to you guys so that you guys can review them.
Thank you, Bill.
And for public comment, please push *6 on your phone or click the raise hand icon to get in the queue to speak. And Kim, there's no one in the queue at this moment, so I'll get back to you.
I actually appreciate that because that gives us a few minutes to talk together about next steps. And of course, feel free to reach out to any on the CDA team as well as our master plan stakeholders, equity work group, Kevin and Rigo. We're all, this dialogue will continue. Couple things. First of all, please do send us, Carmen Gibbs is your point person, but send us resources like you just mentioned, Bill. We are working to agingca.gov is your one-stop shop for aging, and we're working very hard to make that more comprehensive and more user-friendly. It's changing almost daily. So we want to be a better sharer of these kind of promising peer practices, peer-to-peer. So please let us know about things like that. Also, I'm very happy that Donna Benton and Susan Damaris and a couple other Rigo are putting together a kind of a new webinar Wednesday focused on supporting families and supporting caregivers. Donna or Rigo, or do you want to talk about that give a quick promo for that?
Rigo, I think Rigo was going to do that for us.
Sure, happy to. Thank you, Kim. Yes, so Susan, Donna, and I actually been chatting and collaborating with you and your team on looking at developing a short educational series for caregivers and older adults. Essentially, the goal is to reach caregivers and older adults who are isolated, disconnected, or we've used this word quite a bit with marginalized. And so we, in looking through the equity lens, looking at particularly low income, digital divide, low access, language capacity, race and cultural perspective, we're also wanting to look at things through an intergenerational consideration. We have developed a framework by which we're hoping to achieve some of the goal and some of the objectives, and also thinking about it, working through this framework in partnership already on the MPA. Many of you on this call, faith-based communities, ethnic media, other trusted, more local organizations working with these particular communities who are, often sort of on the edges and trying to find ways to connect with them more effectively. And I think it's timely that, like Cheryl raised some family dynamics that are resulting from these situations that sounds like this kind of programming will be extremely helpful. And there's different ways that we've heard, maybe WhatsApp and other things that we might want to look at. But with that said, maybe if I could ask Susan to maybe just quickly share a little bit about the framework. Susan, are you on?
I think she is, but I don't know if we can unmute her. Nelson, can you see her in the, I don't think we know which phone number she's calling from.
Okay. Well, maybe Donna, you'd like to share any thoughts about the framework itself?
Yeah, the way we were looking at it is we wanted to reach people who might be caring for somebody, what we're calling long distance, but long distance can be now defined as even having someone who's placed at this time and they can't reach out to their family members. So what can we do in that area to help people who may have anxiety around that? The other quadrant we want to look at is we do want to talk about wellness and ways to find healthy ways of managing stress during this time. The other two quadrants, Rigo, you might remember them better. I know Susan wrote them down, but.
Well, I think what we could do is actually.
You got them, yeah.
We could definitely, we can forward that to folks. We have a framework that we've developed and we're talking about, caregiving situations, both in the home as well as in, long distance, and also trying to be a caregiver of someone who's in a facility, for example, and having to deal with those kinds of issues, and in working through some of the issues that I mentioned through the equity lens. So we're trying to address a number of different kinds of scenarios as a caregiver in these particular situations. And we're hoping to find ways that are effective in educating and informing the caregiving community through, through various creative ways. So we're not only reaching those who may already be well connected within our resources, but particularly those who, maybe, very sporadically connect, or even those that have not. So that's why we're also looking at other partners that we might be able to bring to the fold to help us increase our reach, to connect with as many people in different platforms as possible.
That's great. And we're so excited to have the webinar Wednesday be able to pivot and be more driven by the community, and we're happy CDA to partner and host it, but that it really is coming from the community leadership. And I think you're aiming to start this Wednesday coming up. I'll do a little spoiler alert that Maria Shriver, we're partnering with her on an Alzheimer family event you'll be hearing about very shortly, but hopefully Wednesday the 15th, we can kick this off and you can spend your Wednesdays, possibly afternoon, acknowledging so many caregivers have very full mornings, but more to come on Wednesday events that we will work very, very hard to be accessible. I think where that leaves us is kind of 4 buckets. One is sharing resources better, and you heard Dr. Clark Harvey offer broadband resources. We also have Judy Thomas from Compassionate Care emailing resources to help health facilities who are trying to work on triage, but how to do so in a way that does bridge with the disability and diverse communities. These are tough issues. And so there's lots of resources that we want to share, and of course want to make it easier to find things like the governor's statement on Monday that there would not be any rationing on disability or other discriminatory basis. So we want to get our resources better organized, and not just the government's, but all of yours. So send them to Carmen, send them in, and we are working to make them more visible. Second are these new series of community gatherings, if you will. And I hear all your great feedback about keep it simple, numbers simple. We can look at other technologies. Third, I think there really is a lot of policy recommendations that I heard in here, whether it's the digital divide, whether it is health disparities and economic disparities, whole family strategies, data collection, anti-discrimination, and equipment, whether it's hygiene kits, masks, or PPE. And so I think it would be great to hear more from the group about an equity agenda that we could all use to chart our work and hold each other mutually accountable. And then I think the fourth question for me is when and how we convene again. And so I'm going to look to Kevin and Rigo to consult with Carmelita and Carmen and myself and kind of think about, I know we're all running and busy, so want this to be a support and not a stress. So let's think too about when and how we stay connected. That's the most important thing, is to stay connected, but when and how we can think together about that. Rigo, Kevin, Carmen, Carmelita, anything to correct or add on to?
No, that sounds right. Thanks.
Sounds good.
Yeah, absolutely. Thank you.
Thanks, everybody. Thank you. Be well, be safe, take care of yourself, and we will stay in touch in all these new ways as we move into this new land together. Glad to be doing it with you. Thanks so much.
Thank you.